Good evening, everybody, and welcome to this conversation. I am excited to be hosting this along with Mr. Naresh Hasija. Glad to introduce Naresh. He has 20 plus years of experience in the pharma industry, clearly being a champion of expanding access to drugs in the Indian pharmaceutical market with extensive experience across both the public markets and the private markets. And again, combining that experience across leading Indian companies, Dr. Reddy's Biocon, with his most recent role at Mylan, now Viatris. Welcome, Naresh. Glad to have you on this chat and look forward to a conversation.
Thank you, Pushpa. All views and comments which I will express here are my own, does not reflect of a company.
Now that we have the disclaimer, we look forward to diving into your comments, your thoughts, and I'm glad we can do that. Naresh, I preface the introduction referring to your work across both the public and the private markets. I'd love to have this conversation today around the element of access to healthcare, around how care is expanding and evolving in the Indian pharmaceutical market. And dive into a little bit across some of the therapy areas, but also a little bit around public and private procurement. I know that Mylan has been a champion on the TB side, and you yourself have several experiences to share in terms of how access to drugs in TB is truly an interesting case to enumerate across other indications. Because despite the challenges of MDR and XDR TB, making the mission of eradicating TB a lot more difficult, I think pharma has been a strong stakeholder for the government in this journey to conquer this problem. So can we start off by talking about how the industry overall has played a critical role in facilitating access to drugs for TB at scale in an affordable manner and combined with stewardship?
Thank you, Pushpa. I think, as all of you will be knowing, our Prime Minister has taken oath for elimination of tuberculosis by 2025, though WHO has kept a goal for 2030. So I think it is a moral responsibility for all of us, the way we have behaved during the COVID time. Similarly, it's a moral responsibility for all of us to really help government so that we can eliminate tuberculosis by 2025. So as healthcare industry, pharma industry, which plays a major role, I will say that tuberculosis drugs are the most economical drugs available across the world in India. That is one. Secondly, there were no right solutions available around MDR as well as XDR TB. Pharma industry innovation has played a key role. After 40 years, we have now 3 drugs. 2 drugs are already launched. Third drug is in line, which are available for MDR as well as XDR TB. So I will say that probably India will be the most benefited country with this launch of these MDR XDR TB drugs. So and Mylan, companies like Viatris as well as J&J has played a key role in bringing these molecules in India.
And the access to care, at scale, would you call that a journey in terms of an interesting case of public-private collaboration? Because there is the government goal, there's the government making the drug available, but then the industry making it possible for the government to buy it at that price. Would this be a case where, without the collaboration, our achievement of that health outcome is far-reaching and difficult?
Yeah. So if you see a patient journey is like, first of all, it is diagnostic. Then it is, of course, the treatment place, which is hospital. And then a third thing is your treatment. So if you see diagnostic, first of all, let me admire Government of India, Central TB Board, the kind of extensive work they have done in so many years. And the way they are scaling up themselves for elimination by 2025 is really commendable. So 3 things, they have a lot of partnership, public-private partnership running with diagnostic companies, hospitals across India, so that tuberculosis patient need not be running around looking for diagnosis in large hospitals only. They are providing all these services at the bottom through these public-private partnerships. Coming to treatment, a lot of work has gone in those many years where a central scheme has been launched, and this central scheme provides access of treatment through dot centers across India. And these dot centers are lot of promotion is done around these dot centers. Lot of awareness programs are done to tell the population about what is tuberculosis, what are the symptoms you should go for testing. And I think I will say that people are well aware now, knowingly tuberculosis can be treated. Coming to treatment piece, I will say that the central scheme has comprehended all the dot centers requirement across India, and they do a very transparent procurement process for procuring this. And the next solution they provide is uh, these make these medicines available at the root. What one gap I see right now is providing these medicines at the patient doorstep. There I feel government should take some steps so that they can provide medicines at the doorstep of the patient, so that there is no pill missing happening. So that and there is no what should I say, that there is no resistance to the treatment in case they have missed the pill. A lot of new innovations are coming in this space with regard to adherence. Patients should adhere to their treatment. A lot of new companies have come in where they are monitoring this through digital tools. I will see this is one program where they have used technology very well. Overall, comprehensive patient journey is very interesting in tuberculosis, though treatment is little longer.
Fantastic. And in terms of stewardship, Naresh, if you could add also a little bit on how we're ensuring use of drugs for MDR and XDR in a judicious manner, because AMR is a looming threat. I think most we're looking at high resistance to antibiotics like carbapenems today with no real solution in sight. TB is a great case. MDR and XDR is a problem because drug resistance has become an issue. So how do we ensure that the tools we have in terms of drugs for MDR and XDR are judiciously used only when they are needed? How are we doing that stewardship today, and how is industry and government doing that together?
So I will say that government has taken a really good commendable position in providing these drugs, looking into AMR very well. They have not provided free access of these drugs to the public or to the private sector as of now. What they are doing is they are running this higher antibiotics through government scheme, and procurement is under a cap. Drug approvals are under cap, and procurement is through them only. I see one gap here, basically, which I would like to really highlight, and I feel government is working in this space. And 2021 going forward, this is one area even we would like to work is uh, providing controlled access to corporate hospitals. Where, for example, if there is an MDR or XDR patient goes to X hospital, and hospital cannot deny the treatment, in those cases hospital has a committee, basically, which involves one or two people from central TB board. They give their consent, and post their consent they give their consent whether this antibiotic can be used in those patients or not. Post the consent, I think then treatment can be started in that hospital itself, in case patient is not able to go to government facility. So if that can be added, this answers the problem of the access at even corporate hospitals. Keeping AMR in mind, everything will remain in control.
Yeah, that would be great to institute. If there is a process for stewardship in the private markets, then care actually is easier to access for people who first go to the private system to access care. Great. I will shift gears here, Naresh, from TB into the current COVID context. I recall when we were chatting yesterday, you were mentioning how Viatris has actually facilitated access to remdesivir, in the public markets. Industry has been, great respect for what pharma industry has done. in terms of facilitating rapid access to drugs during COVID. You want to talk a little bit about industry efforts in the COVID context and ensuring accelerated access to drugs at scale, despite a lot of logistical and practical challenges.
So, the first of all, during COVID, our important job was to really take care of our employees because we never shut. I think our factories were working because we manufacture a lot of essential drugs for the world as well as for India. So, and then remdesivir was next challenge where I would like to thank our R&D team, our regulatory team, and of course the country's regulator who gave quick approval. And post that, I think access of remdesivir was provided. So it was very tough those days because of logistic and transportation issues. But necessity is the mother of invention. We could innovate ourselves. We could reach out to doctors digitally. We could reach out to our teams digitally. Our teams could reach out to procurement agencies digitally. And I will say that we were the first organization which reached out to all the 25 states and we supplied remdesivir to our public market across India. We developed a lot of digital tools in case which we used particularly in Maharashtra where deeper districts where access was a problem because we do not have deeper distribution network at that time. So we developed those digital tools and circulated those digital tools so that you can make your payments and treatment can be provided at your hospital itself. Remdesivir was in particularly cannot be given to patient. It was just a supply to hospitals. So I will say that overall industry came forward and many companies did a lot of innovations to make sure treatment is provided at the bottom.
And what I find most interesting is that you referred to supply to governments, to the state governments, as is what you did, as compared to there is always it's much easier to put the drug in the private market than to engage with state governments, trigger a procurement opportunity, service the procurement opportunity. Have you been observing an ease of access? How difficult or easy was it to work with state governments to activate and serve that procurement requirement?
So personally, if you ask me, I see a drastic improvement in this space in public procurement, where all our procurement agencies of the country, people who are working day and night. They were our champions. I will say that they were working harder than the private sector. They worked day and night and made sure last mile delivery of those medicines was done by them. So I remember days where we used to get calls at 2 o'clock in the morning and till 6 o'clock we are sorting out issues so that availability is there, which we haven't seen in the government system yet. And I will say that, and even doing this, they followed the whole transparent process of procurement. Huge change in India around in COVID we have seen around the procurement.
Interesting. And has this element of ease of procurement in public context, the ease of doing business in some ways with the public procurement system across states, has this been a trend for a while now that's been brewing? Are there states that are easier to work with, have set a role model? I know I keep hearing of Tamil Nadu often, but are you seeing this as a progressive change? Has it become easier to work with public procurement as such in India across, whether COVID or not COVID?
Yeah, we worked with almost all the states in India. I will say that first state in my mind will also come is Tamil Nadu. I think they were the best, Tamil Nadu, and then we were positioned in Karnataka. So this was our priority to serve the state of Karnataka. I think they were also the best. Karnataka, Tamil Nadu, Andhra Pradesh, Telangana, Haryana, Punjab, so Assam, state of Assam, Maharashtra. So Gujarat, these were the states I think who were forthcoming and they were very, very aggressive so that medicines can be provided to their all patients at the bottom. So I will say that they made sure every hospital, every government hospital who's treating COVID is following the protocol of treatment as well as enough medicine is available at the bottom.
And even in a non-COVID context, Naresh, are you seeing digitization in public procurement? Has there been a receptiveness to new drugs? Are there cases where, can you share some example of where we've been able to get drugs into public procurement which are not, which are not on standard EDL list already?
So I will give you an example of viral hepatitis treatment. So when viral hepatitis came in, when DAs came for treatment in India, so when these treatments were available, these treatments were available at cure rates were very high, and a lot of companies in India introduced these drugs. And all the state governments where high rate of infections are there, I think those guys picked it up, and they really worked very hard for elimination of viral hepatitis across India. And finally, after states did a lot of good work, this became a central scheme. Viral hepatitis elimination became a central scheme. This was one good example. I can say that good acceptability was there across India.
Interesting. And what I again find very intriguing here is that you're talking about states picking up the initiative to introduce the drug and then that translating to a central scheme, because it's much easier in a case like PV where there is a central program, there is a national focus for states to become part of that overall mission. And there is a more cohesive effort. But what's intriguing about the viral hepatitis example you're bringing up is that you've seen states took the initiative, the drug was available, they adopted, and then it spread to central.
Yeah.
And did industry advocacy play a role in states appreciating the potential impact of this drug?
Yeah, of course. I think if you see viral hepatitis is not uniformly spread across India. Some of the states have this as a major problem. Some of the states have this as a less problem. So that was the reason probably a central scheme was not formed, because this is not a universally spread disease. Some states picked it up because this was their problem. And yes, you're right. Actually, first time we also saw for a change where industry worked very closely with a lot of awareness and advocacy in those states where infection rate was very high.
And what states would those be, Naresh, which took this lead?
So it was like I will say that Punjab, Haryana, and few states in Northeast.
Okay. Seeing something similar even in cases like brucellosis today. I mean, it's a zoonotic disease, slightly different. But yeah, Punjab, Haryana seem to be taking the lead. I'll shift gears into oncology here. We did we brought out a biosimilar white paper some time back, and I've always been somewhat disappointed with the level of biosimilar penetration in India. Because, even today, take a product like trastuzumab and translate it to percentage of breast cancer patients who get access. It's less than 15% of patients who get access to it at a broad level, right? So access to care in oncology is a journey where India is still, somewhere at the beginning of that. We have a long way to go to really address problem of access to care. But within that, access to drug is a part problem there. So in oncology, can you walk us through what your perspective is on how access to drugs is expanded? Are we encouraged by where we stand today, both in private markets and public markets? What's happening on broad, expanding access to drugs which are more contemporary, could be biologicals, could be peptides, going beyond the traditional plastics. What are we doing? What's happening in private markets? What's happening in public markets?
So I will say that non-communicable disease, the NCD scheme of government has been taken up very well by some of the good government hospitals. If we take an example of Tamil Nadu, where you will see that in district hospitals, when we visit, a lot of district hospitals have oncologists sitting in those and treating oncology cases. So, and of course, when they are treating oncology cases, there is a public procurement process of procuring those medicines, and industry is also coming forward for awareness, for better screening of those population, and it is happening in some states. Then you have Tata Memorial Hospital doing a lot of good work, increasing access of cancer centers across India, and they do a real robust work by fixing up the protocols, and they have regular tumor boards, ethical committees are working very closely, And in those cases, I will say that access, particularly in public market, is increasing for these drugs. As you rightly said, peptides, biosimilars, TNIBs are, I think, are taking up a good shape here in public market. And of course, private market is always forthcoming for treatment to population, and a lot of new cancer centers are coming up across India. Now, focus is increasing on tier two cities where a lot of new cancer centers are coming up, and a lot of trainings are happening in public health where a district hospital doctor is given a basic training for giving chemotherapy, and state is taking a lot of initiatives for their population so that cancer patients can be treated without mobilizing them to very long distances. So this is also, we are seeing it's happening in India.
Okay, that's encouraging because the challenge that we were seeing in some of the expansion of access to drug was also that it was overall access to care. So if it's an adjunct and you can't do chemotherapy, you don't have access to, you're not able to get the patient back for cycles of treatment. The loss to follow up, it becomes a real problem in terms of continuum of care. Interesting. Overall looks like one of the themes you were referring to in terms of COVID context was digital. It's clearly today a big wave, whether it is me trying to get a consultation with my kid's pediatrician, or it is a pre-surgical, post-surgical consult. The leading OBGYN hospital tells me they've moved half their consultations during the course of pregnancy to a digital mode, and they hope to continue to do that, even at the end of this pandemic situation. So can we hear your perspective on what's happening in digital adoption broadly? How is that going to impact care delivery in Indian context, from the pharma angle and from your vantage point to the industry?
So I will say that digital consultation, which is a very important part, I think telemedicine has played a good role, which we have been talking for, I would say, almost from 20 years. Telemedicine should come in place for people, because people at the bottom should not be mobilized for primary and secondary care to always to tertiary care center, particularly in government. So they should be given primary, secondary care at the bottom of pyramid itself. So naturally, we saw a lot of pickup of teleconsultation during COVID time. I will say that some of us have already become habitual of teleconsultation, and doctors are also preferring teleconsultation because if it is a primary or secondary care, they are able to ease out patient problems. They are able to talk to patients, and if a lot of regulatory changes are also expected in this space, so that everything is done properly. Apart from telemedicine, so we as an industry should reach out to doctors. A lot of digital thought process is put in. A lot of thought process is put in this space. Segmentation of doctors is done so that we can reach out to doctors digitally. That knowledge can be imparted, industry knowledge can be imparted to doctors digitally. And of course, our on field force, how do we connect with them? So there was the trend was we used to connect with them physically, maybe once in a month or once in 3 months. Now that is converted to digital way. Most of the times we are on digital mode with our teams, though it has made our life really hectic. So throughout the day we are digitally available. But yes, this is the way to go.
So, do you perceive, Naresh, looking forward, that some part of the clinician engagement for pharma industry will continue to be digital? I mean, now I see some reps starting to come back to meet doctors in the clinics. I mean, maybe some of them are meeting them outside the clinic, but do you evolve? Do you perceive this will continue in terms of digital engagement? Will that wean out once we can meet in person? How do you foresee digital engagement, clinician engagement continuing for pharma industry?
So as you know that India, we are a very large country. We have all kind of segments. We have, I will say that in metros, tier two, tier three cities. So India will be behaving with a mix of online and offline. Yes, digital is going to stay, no doubt about it. But there will be a lot of offline work also in tier two, tier three cities. But as you rightly said, digital is going to stay here, and a lot of doctors started preferring now digital way of working.
That's encouraging. If there is cost saving, that's good for the industry. It's good for the patients. Finally, looks like efficiency is here. I know we have a few minutes left with us and not much, so I will, as a closing discussion, love to hear your thoughts on Ayushman Bharat. I know I think we're all encouraged that finally the kind of attention healthcare needs as a subject, it's getting at a central government level, right? We've had substantial increases in allocation. There has been a concerted effort in terms of expanding the program. And I think with COVID coming, the attention to healthcare has increased. So again, what are you looking forward as a concluding remark? How would you foresee Ayushman Bharat impacting access to care, healthcare in India? Are we seeing a substantial change in terms of how care is delivered in India, how care is accessed in India 5 years forward, 10 years forward?
I will say that this is again world's largest healthcare scheme, which is like incepted very well. Inception is fantastic. They have followed what we see in developed market. They have followed the same, and it is really a good encouragement for population, which is going to seek for treatment. I'm more than confident this scheme will really change the treatment in public health. For population which is dependent on public health, I think this scheme is going to speak by itself. They are following every day. There are new developments around it, and lot of disease, the major disease which India is forcing, and I think all this are included in Ayushman Bharat. This is one scheme which will really make half of our population under the umbrella.
And so combined with what we spoke about, state government initiatives, free drugs program, TB, viral hepatitis, you're saying Ayushman Bharat brings it all together, is the umbrella we need in terms of overall access to care. Any concluding remark, Naresh? We're at the close of the program. I've not run out of topics to discuss with you, but I see we're timed out. So I'll turn to you for a concluding remark and then we'll wrap up.
I will only say that I think this year's budget has really taught us so many things. Why we should really focus on COVID has taught us all this. Why we should focus on healthcare. And when we see budget, it's really heartening. Where finance minister has announced schemes and major focus has come on healthcare. And we are really proud to work for this sector where we would like to serve the population of India such a way so that all of us stay healthy. I see a major change coming in from treatment to preventive care. Lot of wellness centers are created across India, which will add value to everybody. So I think this is one space apart from running treatment. I think wellness is a new theme where all of us will be really getting benefits. Thank you.
Thank you, Naresh. And I'm very glad to conclude on that note of mutual pride that we both share in the healthcare space and in what's happening in the Indian context. Before we wrap up, I'd love to thank Voice of Healthcare for this platform. These are the kind of conversations we need to have so that we are able to take this ecosystem to the next level. So thank you for the platform. Appreciate your time, Naresh. Look forward to future conversations. Thank you.
Thank you, Voice of Health. Thank you, Pushpa. Thank you.